Eileen with Have Lifelong Wellbeing, and this particular educational video is going to be on causes of back pain when turning. Now, obviously, there's a lot of different reasons that you can have back pain when you're turning. My point here is to teach you things that aren't necessarily well known, not mainstream knowledge, but ideally should be mainstream knowledge. So my goal is to teach you something a little different from what you might find elsewhere, right? So you may or may not be aware of this, but your spine has curves. Your neck curves in, your thoracic spine or your trunk kind of curves out. So, you know, if I'm turned sideways, my neck will turn in, my thoracic spine will curve out, and you're all familiar with, you know, the dowager's hump, right? Where someone is kind of hunched forward and their head is way forward. As they age, they just keep going down. I'm not going to talk about that today, in a future video. But then below the trunk, the lumbar spine curves in, the low back, and then the sacrum, or the pelvis, curves out, right? So we have those curves in the spine, and it makes it 8 times stronger than it would be if it was completely straight. And I think I mentioned this in another video, but those antique chairs with those tiny little legs you wouldn't imagine could bear weight, they can because they're curved. It provides more strength. Now, the reason I mention the curves in the spine when it comes to causes of back pain when turning is because your spine also is designed a little bit differently in each area. You know how we call neck is cervical, trunk is thoracic, low back is lumbar, pelvis is sacral, and we have different names for those different areas of the spine, not because there's some little wall in between them, right, and it stops and starts there, but because of how the vertebrae are oriented, because of how they connect with each other, how they cozy up to each other, the angle that they're at, the size of the vertebrae. As the spine goes lower, the vertebrae get a little bit bigger, a little bit stronger, right? The vertebrae in the neck, just holding up the head, don't have to be all that big and strong. But as you get lower in the body, the lumbar has some pretty big vertebrae, big and strong, and they're all at a different angle with each other. And that angle sort of gradually changes, all right? And I don't want to go too deep into it, maybe in part 2 of this, because there is going to be a part 2 to causes of back pain when turning, because there's more than one cause that you may not be aware about. So what I'm going to talk about today is the lumbar spine. The vertebrae are oriented to each other or connect with each other in a certain way, which allows for a strength of movement and not so much its biggest ability. Okay, so some of you may have remembered many years ago, you may remember this depending on your age, that people used to be taught, don't turn, don't rotate when you're working out, because if you turn when you're working out, you're going to injure your low back. Well, the reason that that myth was put out there, it was based on anatomy and physiology of the body. Anatomy is how the parts are designed, and physiology is how they function, right? So form and function. Now, the low back, because of how it's designed, it's really good at bending forward and bending backward. That's its strength. It's real happy when you're bending forward, and if you didn't see my video, Causes of Back Pain when Bending Forward, please watch that one. But when you're bending forward and when you're bending backward, and I'll do one on causes of back pain when bending backward, I promise. But for now, we're talking about turning. The lumbar spine isn't designed really well for turning. It doesn't have a lot of motion there. When you turn, the lumbar spine has very little mobility or ability to rotate. So a lot of people thought, oh my gosh, because of the physiology, because of the function of those vertebrae, the form, they don't like to turn, so we shouldn't be turning. That's why so many people are blowing out their back. That's why so many people are having, you know, herniated discs and all this other stuff. It's all that turning we're doing. Well, that's not accurate. Yes, the lumbar spine's not real good at turning. It doesn't really like to rotate. It doesn't really have an ability to rotate much. Relatively speaking, it's a small amount of rotation. It's really good at flexing forward, really good at extending backward. But here's the deal. You got other parts to your spine. The lumbar spine is only one spot, right? It's between the trunk and the pelvis. You've got your trunk, which has 12 level of vertebrae. The lumbar only has 5. You've got your neck, which has 7 level of vertebrae. Lumbar only has 5. You've got your hips, which are right below the lumbar spine. And guess what? Your hips are the second most mobile joint in your body. Your shoulder's the most mobile. Your hips are the second most mobile. So those hips are designed to rotate, and rotate really well. So is your trunk. Your thoracic spine, it's kind of like Ginsu knives. It does it all. It rotates really well. So when you're rotating, which is a big part of life, what's supposed to be turning? The trunk and the hips. Low back isn't really required to turn unless the trunk above and or the hips below are not turning. So what I'm going to talk about in this part 1 is hip rotation. How well do your hips turn? And I'm going to show you a little workout. All of this is, done at your own risk. I don't know what's going on in your world. You do. If you were told not to turn by somebody, I'm not telling you to ignore their advice. It depends on who they are, their expertise. What do they know? What do they know about you? What imaging have you had done? What diagnoses have you been given? That's a whole nother story, right? But if you feel in your world it's okay to try these, I'm going to teach you a couple of things. So the hip, it rotates in, right? Internal rotation. You can see my foot moving in there. And it rotates out. That's external rotation. Now, I can stand here and do this all day long. There's internal, there's external. There's internal, there's external. But do we do that in life? Is that really functional? Is that how our hip needs to be able to move so that we can go back and forth between the stove and the refrigerator when we're cooking something in the kitchen? Is that how we need to move when we go to, get our child out of the back seat of the car and we turn to move away from the car? Our hips have to turn in weight bearing. This is non-weight bearing. I pick my leg up, I turn my foot in, I turn my foot out. Guess what? If I keep that foot planted, that's weight bearing, and I turn in and I turn out. That's weight-bearing rotation of this leg. I'm turning in, I'm turning out. So, these are things for you to assess. Are your hips rotating right? Do that on both sides, right? I'm going to rotate in, and you can see my feet are kind of making a letter T, right? My left foot's like the top part of a capital T, and my right foot is like the vertical bar of the capital T. That's a nice rotation of my hips. I can try turning even more into that and see how much rotation do I have. Now, if this creates back pain, you know your hip is not rotating. Your right hip is not good at rotating internally because the lumbar spine's not required to rotate for this motion. Hardly at all. Like almost nothing. But that hip, yeah, that hip has to rotate in when I do that. Okay? And then you're going to try both sides. So now I'm going to put my right foot in front of my left and turn. And how is that? I got nice internal rotation on both hips, right? I don't have any restriction here. You can see that. I can turn and look behind me. Plenty of rotation in this hip. Internal, in weight bearing. Let's try external rotation. Turning out. This is non-weight bearing. Turning out. But this is weight bearing. I'm going to keep that foot planted and I'm going to turn this way. Now, soften that knee. Don't lock that knee, right? Because we don't want to hurt the knee. But ideally the rotation here is happening at the hip. And so I'm going to keep going. And I've got plenty of external rotation in this hip. Look how far I can turn. I can look right behind me. Okay? And then, of course, we would try the other side. So now my left leg is planted. I'm going to turn my right foot, and you can see I've got a nice 90-degree angle here. It's kind of like my feet are making the letter L shape, right? So I'm not turning directly sideways. I'm stepping behind me. It's kind of like a back step with a twist. because if I just go sideways, that makes it very awkward. But if I step a little bit back, which is what you would do in the kitchen, oh, I'm going to get something out of the fridge, right? Look, I've made the letter L. I've done that beautiful external rotation of this hip in weight bearing. That's what you want to do. So let's see. Yep, I can turn all the way behind me. Keep that knee soft. You don't want to lock that knee. You want to keep it safe. I'm putting weight on this foot that I move. The foot that moves, I'm putting weight in that as I turn and I look behind me. Full external rotation on this hip. So if you've got full internal and full external rotation of both hips and you have back pain when you're turning, guess what? You might need to watch part 2. Okay? I hope you're enjoying these videos. Please put some comments in the box and let me know if this is helping you or not. I'll see you next time.